Right, but Annabelle, has the vaccination rollout, the success of it in terms of the numbers of people that have been vaccinated by the NHS, point to a more centralised way of running health services in England as being better?
Well, certainly the vaccination rollout has been a great success for the country and for the NHS, but fundamentally what we need is root and branch reform of the healthcare service. Now, over the course of 2020, NHS had net approval ratings of between 80 and 88%. And what worries me is that while this was, I imagine, mostly about the heroic efforts of doctors and nurses on the front line, it's going to make reform of the NHS extremely difficult. We need to remember that these workers are trapped in a failed system, and that ultimately we did have one of the worst excess death tolls over the course of 2020 and as a result of this pandemic.
It's not a failure of the NHS, though, that death toll. I don't know that that's a failure of the way the NHS operated. It might be the failure of the way government operated through this crisis. I don't think it's a mark of failings in the NHS.
Annabelle?
I'm so sorry, I didn't quite catch that.
Oh, well, Gabby, repeat it.
Sound issue.
Sorry, I hope everyone heard that. But no, I wouldn't say it was a result of failings in the NHS that we had one of the highest death tolls in the world. Failings of governance, maybe failures of policy, but I'm not sure what failures within the NHS you identify there as contributing to the high death toll. Annabelle?
Well, I think it's very difficult to really learn any lessons from this pandemic, but it seems that one of the conventional wisdoms is that the NHS and any mistakes or missteps there might have been is now beyond reproach. But if you look at some of the countries that have performed best on the key indicators, particularly in terms of healthcare outcomes, they're the Asian tigers, and they have healthcare systems that are nothing like the one that we have here in the UK.
That's not to do with their healthcare systems. That's not to do with their healthcare systems, surely. That's to do with their success in test and trace. That's to do with the speed in some cases with which they close their borders. That's to do with previous experience with SARS and MERS. I don't know that it's to do with the quality of the healthcare provided. You know, the issues that we've been looking at in this country are, could we get test and trace off the ground? Did we lock down too late? Did we unlock too early? You know, those are policy decisions that are taken at the top. And of course, there may be some issues there about how the NHS and government communicate to each other, or how government and scientists communicate with each other. But I don't think that we're looking at necessary failings in hospitals, apart from maybe bed capacity. That might have been an issue.
Annabelle?
Yes, I mean, that's certainly right that we have fewer beds than you see in other countries such as Germany. But you cannot deny that the NHS is a collapsing, buckling system that needs fundamental reform. And were we able to reform it, then perhaps we'd have healthcare outcomes more similar to other developed nations, unlike ones that are more similar to what you get in nations like the Czech Republic and Slovenia.
Right, well, Damien,
I'm not sure that collapsing and buckling is the opinion most people have after the amazing year the NHS has proceeded, to be honest.
Right, well,
Damien, we all collapse and buckle so badly.
No, well, do you see it as a buckling service, Damien, in the way Annabelle has described it, and that, in fact, it's the fault of the NHS system rather than politicians' decisions that have resulted in poor outcomes and a high death toll?
No, I don't see it as a buckling system, and I think actually I find that description quite offensive, given the extraordinary efforts the NHS has made over the last year to serve the needs of the nation through COVID. And we've not seen what we've seen in some other European countries of people, you know, not being able to be admitted to hospital for treatment because there weren't the facilities to treat them. I think with the increased capacity, with the Nightingale hospitals, with the fact the NHS is leading a world-leading rollout of the vaccination programme, I think these are all things that we should be very proud of. But of course, I think what the pandemic has done is stress tested the whole system. And I think there are things that can be improved in terms of the way data is shared between different aspects of the NHS to improve the delivery of services. And I think there is a big public health question as well about saying, do we need to be fitter and healthier as a country? Are there other lessons to be learned when we look back at the impacts of the pandemic? Okay. But I think actually one thing we can say is that, you know, through national effort, you know, people supported and protected the NHS by adhering to the lockdowns. The NHS had the resources it needed, and it's done an incredible job.
Right. Well, just briefly, Annabelle, you wanted to say something about Nightingale hospitals, I think.
I was just asking Damien how many patients were actually treated at the Nightingale hospitals. And I just reiterate what I said at the outset, which is none of this is to downplay the heroic efforts of the doctors and nurses on the front line. But the issue is that they are trapped in a failed system. In terms of outcomes, quality and efficiency, it's social insurance systems that are consistently ahead of the NHS. I think we all want the same endpoint. We all want people to have access to the best possible healthcare. It's just that system like the NHS isn't able to provide it.
Right.
I think we're on to a very different subject here, but I think the performance of social insurance systems versus the NHS is highly contested. firstly, in a pandemic, it's been a huge advantage having a universal healthcare system where people aren't frightened of the cost of going to the doctor and aren't worried about whether the insurance is up to date and so on and so on and so on. I think we've got here a case of overlaying an existing agenda for reform on a pandemic. You know, everyone may have had their own ideas about how to reform the NHS before this pandemic started.
All right.
But that, you know, just sticking to those isn't learning the lessons of what the years taught.
All right, we're going to leave it there.